Hi everybody. So here at Integral Performance Physio, one of the questions that we get very often is when should you actually seek a physiotherapist? And this is actually a very important question because many patients that we encounter here, they end up waiting a very long period of time before actually consulting a physiotherapist. And what problems that might cause is that when you wait for too long, you end up developing a lot of compensatory patterns and you're protecting the injury, which actually causes a less optimal recovery, a slower recovery, and sometimes you might actually end up with more problems surrounding the area of the injury. So this question, when to seek a physiotherapist, is one that we want to be able to address right now. So we developed a 7-point checklist shown right here. And you can consult this to see if you're an appropriate candidate for physiotherapy. So let's go through these points and I'll explain why each of these are important points to consider. So the first point is pain for over 10 days without any improvements. So this is an important factor because normally after an injury, there's what's known as an inflammatory phase. That usually lasts from 24 to 48 hours, and that's your body's mechanism where it is trying to send the necessary proteins and factors into the area in order to help recover the wound or recover the injury. This lasts usually 1 to 2 days. Now, if your body, after approximately 7 days, you still don't see any improvement in the injury, you don't see any improvements in the pain, then that means your body is actually having difficulty to be able to recover on its own. And that's when you should see a physiotherapist, and we'll be able to identify exactly the source of the problem as well as what is limiting your body from recovery and be able to unblock that for you, which will then allow your body to get back on track for its recovery. So that's number one. So the second factor is loss of ease and range of movement. So if you notice after an injury that, let's say you hurt your back, and then suddenly you feel very, very tight, you're bending forward to pick up something and you feel a strong pull in your back. That is something that physiotherapists commonly work with, is stiffness and tightness. This is also something that's very important to address because if, for example, you're bending forward and you're bending halfway and you already feel a tight pull, imagine if you had to bend to the ground to pick up a shoe, or you had to bend to the ground to pick up your kid. That means you're overstretching the fibers and the muscles in your lower back, and that means when you need to add on an even heavier load and you have to lift something, you're working at the end range of your back. And that's actually the range where you have the most risk of injuring yourself. So by coming to see a physiotherapist, we can help work on that stiffness, help you reestablish and regain your full range of motion, and this will also help prevent you from getting future injuries. So the third factor is loss of localized strength or stability. This is something that we very commonly see, is that our patients will complain, oh, my back's very weak, or I've had many ankle sprains and my ankle is very weak. When I play soccer, I feel like if I do just a bad movement, that I'm going to roll my ankle. So whether it is after an ankle injury and you want to be able to restabilize your ankle, or it's that you had a back injury and you no longer have the endurance of standing up and washing dishes for 10 minutes, that is something that physiotherapists are specialized in to be able to, one, prescribe you the appropriate exercise to where you are right now, and given the circumstances that you're in, whether you have access to a gym or you have only minimal weights at home or you have no equipment at all, we'll always tailor the exercise programs according to what you're capable of doing, so that you can progress and gradually build up your strength until you're able to achieve your objectives. So that's number 3, loss of localized strength or stability. Number 4, feeling muscular tightness and stiffness. Now, this is somewhat similar to number 2 of the loss of the range of motion, because when your joints are not able to go through that range of motion, then that means you're also not able to stretch your muscle through that range of motion. and that develops muscle tightness. Now, probably the second or third most common thing we see is neck tightness and upper back tightness. Now, this is likely from spending a lot of time like this in front of the computer, and then you develop tension in these areas. Now, this is also related to number 3, loss of strength. Usually, when muscles end up being tight, it's commonly related to the fact that that muscle actually isn't strong enough. For example, that example that I showed, where you're in this position, your muscles are constantly working to keep your back from falling forward, to keep your head up, and you're in that position for the 8 hours a day at your work. Now, over that period of time, the muscles, they fatigue, and eventually they tighten up just to try to hold on to that position. So that means the muscles are also not strong enough to be able to hold it for a longer period of time. Now, as shown from a previous video, of course, the recommended thing is to take breaks, have a better posture, but at least so that you can have a better endurance, it's important to be able to have the proper strength to support the positions that you need to be in. So that would be number 4, feeling muscular tightness and stiffness, whether it's neck tightness, back tightness, hip tightness, tightness after training. That's something that we can help with a lot of different massage, mobilization, and manipulation techniques. Number 5, following a sudden traumatic injury. So many people don't know it, but after an ankle sprain, it's actually very recommended to come see a physiotherapist. Now, the reason for that is, if you think of the case where you sprain your ankle, you rolled your ankle, now you have ankle pain, and it's swollen, you have difficulty walking, and it's very hard to actually work on the ankle yourself. So when you come to a physiotherapist, we can gently mobilize it, we can do massage techniques to help get the blood circulation going. We can also help guide you. What should you do? What should you not do? So that you can optimize the loading on the ankle, which actually optimizes the recovery. The worst thing that you can do is actually just to completely get off the ankle and to avoid using it, because that also stops the recovery. So whether it's an ankle sprain, whether it's a knee sprain, whether you bent forward and twisted your back, we can definitely help with these trauma-related injuries. Number 6 is following an orthopedic surgery. So whether it is that you had an ACL repair, a meniscectomy, you had a rotator cuff repair, you broke a bone, you broke a bone in the wrist, you had a cast for 6 weeks, and that you definitely need rehabilitation following the injury. For example, for the cast, your wrist will have been immobilized for approximately 6 weeks. So 6 weeks of not moving your wrist, it's going to develop a lot of weakness and a lot of stiffness. So that is something that is, again, difficult to work on your own. So it's far better to have a professional to help you work on it, mobilize it, regain the strength, and guide you on the optimal path of recovery. Point number 7 is the last point on the checklist, is fear of returning to activity or sports. So this is different from number 1 to 6, because number 1 to 6 is actually a physical limitation. Number 7 is a mental limitation. So there's a lot of patients that we see that anatomically they have actually recovered. Their injury is recovered, but because of the fear of hurting themselves, fear that if they bend forward, they're going to hurt their back again, fear of if they lift their arm up again, it's going to pinch in the shoulder. The body will develop all these avoidance patterns to try to work around it. Instead of putting on your jacket like this, maybe you slowly sleeve it up. But those are normal movements. You need to be able to regain being able to rotate your shoulder this way, being able to bend forward naturally. And if you avoid it, you never redevelop that strength, you never redevelop that mobility. So breaking that mental barrier is very important. And having a professional look at your back, look at your shoulder, and be able to determine where it's at, what movements are still missing, and how to properly guide you to reestablish that movement pattern is very, very important. We've seen many patients where it is just because of the fear that they end up having prolonged pain and limited recovery. So those are the 7 points. If you said yes to at least 2 of them, then I would say you're definitely a suitable candidate to go see a physiotherapist, and that it would be recommended. The more factors that you said yes to, the more likely, the greater the benefit of seeing the physiotherapist, because all 7 factors are things that we're strongly specialized at working on. Okay, so take a look at the checklist. If you have any muscular, bone, joint pains, and you think to yourself, should I see a physiotherapist? Go through the checklist and then see how many questions that you answered yes to. And like I said, if there's more than 2, then I would recommend you to give us a call or send us a message. And if you're not sure, send us a message, and we'll be very happy to speak with you and determine if you are in need of seeing a physiotherapist. So thank you. I hope you enjoyed the video, and let us know if you have any questions. Have a great day.